Topic is about the clavicle bone. Clavicle bone is placed in the horizontal direction. Entering into the features, we have to know the two terms. One is side determination and anatomical position. Side determination, first point is curvature is in horizontal in direction. This is the only bone placed in the horizontal direction. Other bones are in vertical direction. Second point is the ends of the lateral end is flattened. See this. This is the lateral end is flattened and the medial end is rounded. Medial end is rounded. Roughened area near the ends of the bone. Both sides there is a roughened area. This topic is anatomical position. In the anatomical position, the clavicle extends laterally. The clavicle extends laterally almost horizontal at the root of neck. Below the root of neck, the clavicle placed in the horizontal direction. This is the horizontal direction. Anatomical position and side determination is over. Next I am going to tell about the features and attachment. In clavicle there is the two ends. One is medial end and the lateral end. In medial end there is a rounded end. In lateral there is a flattened end. Lateral end is also called acromial end because the scapula of acromion process attached to the lateral end of the clavicle, so it is called acromial end. Second, it is flattened from above downwards. From above downwards it is flattened. The lateral meets with the acromion process to form the acromial clavicular joint. Lateral end is over. I am going to tell about the medial end. Medial end is rounded in structure. It is also called sternal end because it articulates with the sternum. Second point, it meets with the sternum to form sternoclavicular joint. Ends of the clavicle is over. I am tell about the shaft of the clavicle. The shaft is divided into lateral 1/3 and the medial 2/3. Lateral 1/3, medial 2/3. Medial 2/3 of the shaft, lateral 1/3 of the shaft. First I am tell about the lateral 1/3. In lateral 1/3 there is a two surface and the two borders. The surfaces are superior surface, inferior surface, anterior border, posterior border. Two surface, two borders in the lateral 1/3 of the shaft of clavicle. This part is the superior surface of the lateral 1/3 of the clavicle. Superior surface, it is subcutaneous. This superior surface subcutaneous in structures, and the inferior surface there has a trapezoid ridge. This is the trapezoid ridge and the conoid tubercle. Conoid tubercle and trapezoid ridge in the inferior surface. The surfaces is over. And next one is the borders. Anterior border and posterior border. Anterior border. Anterior border gives origin to the deltoid muscle, and the posterior border provides insertion to the trapezoid muscles. Anterior border is origin to the deltoid muscle. Posterior border insertion to the trapezius muscles. Lateral 1/3 of the clavicle is over. Next part is the medial 2/3 of the clavicle. Medial 2/3 of the clavicle. Medial 2/3 of the clavicle is quadrangular in shape. It has four surfaces: anterior surface, posterior surface, superior surface and the inferior surface. Anterior 2/3 of the clavicle is, this is the anterior surface. Anterior surface is smooth in nature and it shows the convexity forwards. Convexity forwards, and the clavicle head of the pectoralis major origin in the anterior part. Anterior surface pectoralis major is originate in the part, and the posterior part, the posterior surface concavity backwards. The origin of sternohyoid muscle extend on the surface medially. In the superior surface, the sternocleidomastoid muscle origin in the superior surface. And last is the inferior surface. In inferior surface, costoclavicle ligament is attached, and the subclavian groove on the lateral of subclavian groove. This is all about the clavicle bone. Any doubts? Please comment me.